This is Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up-chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Pukeology.
What causes your water to break when you're pregnant? So many moms ask me, so I just can't wait to tell you what to look for, what you should do immediately after, and why the time of your water breaking is so important for you and the soon-to-be newborn baby's health. Want no more morning sickness, pregnancy nausea, or how about no more headaches or migraines? Visit our sponsor, nomonausea.com, the only natural way to instantly stop your worst nausea, vomiting, or headaches now, and get 25% off with the code PUKE25, or just place No More Nausea Band on your baby registry for your delivery bag at Bye Bye Baby, or get it shipped for free in just 2 days on Amazon as a Prime vendor. And know your little ones are always taken care of with the first No More Nausea Kids and No More Sleepless Nights Kids, which works on moms too that have small wrists, now available at your local CVS store. Besides learning about how incredible birthing is, especially when your water breaks, you're also going to hear some pregnancy humor that may just make you want to pee your pants, like you don't have to pee all the time anyway, with stories like nursing, the profession of puckers, the biology of the barf, and recycling. Barf it now, eat it later. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive these 9 months, and just know we're in this together. Today, you will learn the science behind what causes your water to break when you're pregnant. And can the weather cause it to break sooner than expected? Also, some natural ways to speed up the labor process and safely induce your water to break, especially if you're having a home birth. All today on episode 54 of Pregnancy Pukeology Podcast, what causes your water to break when pregnant?
The science of puke, pukeology.
I know you all want to give birth to healthy and happy little babies, and it's coming up faster than you think, mamas. Some of us moms might have been scared of when our water might break. And if you're anything like me, a control freak where I plan on everything, this is Mother Nature's way of forcing you to take the back seat, just like me. I used to keep a puppy training pad in my new car on the actual driver's seat when I was 9 months pregnant, just in case, because the worst thing I could imagine, I was already brushing the baseboards of my house, and I am not exactly the cleanest keeper ever. But I will tell you that I had this nesting. And so I was only envisioning my water breaking all over the brand new car. We had a Honda Accord at that point in time. And all of a sudden my water would break and I would be cleaning as I'm giving birth. Some moms say that their water breaks and it feels like pee, just kind of like trickling down the side. Some people actually don't even know, right? Some experience like puddles, like little puddles, and they're like, man, that's kind of weird. That's a lot more than pee. And don't worry, ladies, it will not look like it does on the movies where it's like a busted balloon. Amniotic fluid is stickier than water and it's not the exact same consistency. So if you're envisioning, the gushing waters like, psh, that's not exactly how it happens. But when your water does break, it assures you that you're ready to welcome in your new baby into this world. And within 24 hours, you will be seeing that little one. But what causes your water to break? When does it happen? What happens when your water breaks? Well, let's find out with a lot more to come. So what causes your water to break? Well, in most pregnancies, water breaking is natural, and it's a process when your body starts to get into labor. Your body or your baby actually has a flotation device, right? It's literally floating in this water, also known as amniotic fluid, which is surrounded by a membrane, which is called the amniotic sac. When you go into labor with contractions, obviously as they're increasing in intensity, your baby moves downward towards your vagina, and a lot of pressure is exerted on the amniotic sac. And together, this strong contractions will usually cause this water to start breaking naturally. At times, your doctor can artificially break your water to induce labor, and they'll perform a procedure called an amniotomy, which is after making sure the baby's head is obviously facing down. However, you don't need to have an amniotomy if your labor is progressing normally and is progressing well, and your baby appears to be in good health, according to the American College of Obstetricians and Gynecologists, which is ACOG. Alternatively, your doctor can induce labor by using a catheter to make your cervix dilate or give you medications like Pitocin. Having sex, believe it or not, stimulation of your nipples will make your body produce oxytocin, which is a natural hormone that plays a significant role inside of labor. Oxytocin, also known as Pitocin, if you've ever heard of bags of Pitocin being hung. So that is our man-made version of oxytocin. And what happens is it's a labor inducer, meaning the contractions, all of your muscles will contract. Think of it like, those electrical things that they have that you put on like muscle groups, if you have, for your back, or it can be for your abs or for your legs. And when it contracts with high intensity frequency, because it's obviously stimulating, all your muscles contract and you're not even doing it. So that's how some people say when they're on the couch or on long drives, they're trying to, get their post-baby, or pre-baby mommy body back, they'll attach these things and it'll literally electrically stimulate it. So you're doing crunches, even though you're not actually doing them yourself. And that's because of the fact of the muscle contraction. Well, Pitocin, also known as your body's oxytocin, is the exact same thing. And sometimes they actually say that eating dates can also help you to induce labor safely. Basically, all of these things are your body's natural way to say, hey, it's time. And I will tell you that if you do have a Cervidil, or if you put something that's going to dilate the cervix more from an external perspective, and that's only a healthcare professional can do that, as well as a healthcare professional or an OBGYN, a physician, can break your water. Now, when it comes to breaking your water, please, if you're planning on having an epidural, get your epidural before they break your water. I'm just letting you know as forewarning, because I would never want anyone to go through extra or additive pain. If you're a person who wants to go natural, go for it. But I will tell you that it definitely does feel like a pinch. Think of it like a hook, right? You're going in, you're hooking it, and you're busting a bag. And that hook or that bag happens to be inside your body, so you can only imagine you're really like pulling and tugging down there. So how do you know that your water has broken? Well, amniotic fluid is clear. Just like if you're well hydrated, your urine should be clear also. But again, your urine does have a little bit more of a yellow tinge to it if you're not super hydrated. Therefore, sometimes you might not realize the difference between urine and amniotic fluid. And again, if you feel it trickling down or you feel like a warm sensation, those are both warm because they were both inside of your body. Sometimes the water gush out, hence, you don't confuse it with urine because you're like, whoa, that's way too much. It is also very important for you to see your doctor when you're uncertain of whether or not your water has broken. They will examine you and they will let you know whether you are leaking amniotic fluid. So I have a nice little acronym for you, and it's also to help you and your provider. It's called COAT, C-O-A-T. So when your water breaks, C, you need to tell your provider or be ready to answer these questions. What is the color of your fluid? O, the odor. Is there a smell to it? A, the amount. Is it a gush or just a trickle? And time. Time is very important. What time did this happen? And we're going to get into the time, but again, COAT. If your water breaks, don't forget your COAT. Color, odor, amount, and time. So what happens after your water has broken? If your baby is at term, labor will then follow within 12 to 24 hours after breaking your water. Sometimes labor may fail to start until after your water is broken. This is called premature labor rupture of the membranes, PROM, P-R-O-M. This requires medical interventions such as taking medication to stimulate the uterine contractions. While the exact cause of PROM is unknown, having the following risk factors can actually make you have or be more prone to having PROM with your delivery. Uterine or cervical or amniotic infection. So remember we were talking about a smell. Usually a smell is associated with an infection, and that's not something that we want. We also always draw blood at the hospital whenever our moms are undergoing any type of labor and delivery. We do that for multiple reasons, not just to tell the anesthesiologist whether or not we could place an epidural or a spinal for your red blood cells and for your platelets, but also we want to see if your white blood cells, if something's going on crazy, if you currently have an infection, your white blood cell count will be up. Too much amniotic fluid or multiple pregnancies, they exert excess pressure on the amniotic sac, making it break. Because imagine, it's like too many people in one hot tub, right? The water will displace itself. It'll just be too much water. Active or a partial smoker during their pregnancy, prior history of PROM, or prior history of cervical surgeries or biopsies. So labor must begin soon after your water breaks to reduce the risk of infection. And this is extremely important. So we're going to actually go into preterm premature rupture of the membranes. That's called PPRM. This occurs when your water breaks before you're 37 weeks pregnant. 25% of all premature births are caused by PPROM. The risk of infection is very high after the water breaks. And this is the reason why, when people say, to stimulate labor, have sex. Well, after your water breaks, you don't want to put anything in there. Whenever we go and check you as physicians or healthcare providers, we're always using sterile gloves and things of sterility. So I can't express enough. Again, that is a one-way ticket to your baby, is actually through your vagina. So we want to make sure that we decrease the risk of infection. So like I said before, PPROM, the risk of infection is very high after your water breaks, and you cannot delay going into labor. The causes of PPROM include having a prior history of having PPROM, smoking, too short of cervix, an infection of your genitalia or genital area and urinary tract infections, having very low weight and poor nutrition, having multiple pregnancies, weak and injured cervix. When we talk about weak and injured cervix, you can actually have a procedure done. Some women have to. And what happens is you will need to help to mend your cervix. So think of it as putting sutures to tie it up tight. Some people, they can't help it. Naturally, their cervix is either too thin or it's just not strong enough. And when that happens, usually when you're giving birth, guys, your cervix thins out. But these are people who are, in their first couple months, and all of a sudden they just want to drop out a baby, right? Because of the fact that their cervix can't handle the weight. So they will actually go in and they will do what's called a cervical cerclage. If you have to have a cervical cerclage, I'm going to quickly talk about it, and I think this would be an amazing podcast for after. But a cervical cerclage is, depending upon how many weeks pregnant you are, regardless, we will actually do what's called a spinal anesthetic. So a little tiny needle goes into the CSF space. We'll give a very small amount of fluids, literally less than half a cc. And when we give that medication, it will numb you from usually your belly button all the way down to your feet. This way you're awake and alert, and then they will go in there with a needle and thread, and they will literally stitch your cervix up to make sure that you get to hold the baby. So again, that's the cervical cerclage in a very short explanation, but that's the treatment for having a weak or injured cervix. Now, going back to PPROM, other entities or other potential causalities of it, including having an intense physical trauma, especially to the abdomen. So if you were involved in a car crash, I had a best friend who was involved in a very serious car crash, and it literally caused her to, rupture her membrane before it was supposed to. Having amniotis, again, an infection. So amnioitis is an infection or an inflammation of your amniotic membrane. And again, also conceiving soon after childbirth, that like when you have what's called Irish twins, I think that's what the code name is, where you just have two babies very close together, your cervix and everything is just, they're exhausted, right? So it didn't get that full recovery of what they say 2 years brings to you. So PPROM can also cause complications to you and to your baby. You may experience an infection, placental abruption, which is when the placenta actually detaches from the inner wall of your womb before you give birth. You might have problems we talked about with infections or having cord problems or complications during and currently for premature birth. It is also recommended that you give birth when PPROM occurs before 34 weeks to prevent infection. However, if you are 34 weeks pregnant but have no signs of infection and your baby is in good health, you may safely delay giving birth after experiencing PPROM. So your doctor will give you drugs, different antibiotics to prevent infections, corticosteroids like dexamethasone. My tongue is tongue-tied today. To basically make the lungs more mature. And those steroids will literally help them to kind of mature more rapidly because they will be born sooner than expected, especially when PPROM happens. When you're about 24 to 34 weeks pregnant, just be kind of on the lookout for that. So I think it's the most important for you to understand what is your role, and your role is coat. Look at the color, the odor, the amount, and the time. Now let's get into something that's a little bit funnier than talking about your water breaking.
Throwing up on a Tuesday? One puke story.
I worked in a nursing home straight out of high school, and one of the residents had a serious bowel infection, making her poo smell absolutely rancid. Ew. 3 of us went in to change her on with masks on, only to find the entire bed was covered in poop. My pregnant coworker immediately started vomiting in her mask. That set the rest of us off, all vomiting while scrambling to get masks off and find a bathroom. By the time it was all said and done, we were covered in vomit and poop. I was never so glad to throw away a pair of scrubs in my life. At LITERATI, that was pukingly perfect for our enjoyment's sake. Thank you so much for adding that into our stories. A couple of weeks ago, I was in my biology class at my university. My professor walked in looking like she was going to puke. So being a considerate student, I asked her if they were feeling okay. And the answer, no, not really. I might just go home after this class. So anyway, she started her lecture, and when all of a sudden she started to vomit pink color chunky liquid. Obviously the class started saying things like, gross, she's blowing chunks everywhere. What the sicko is going on? She tried to get out of the door, but it was stuck. She kept throwing up again and again, and the vomit was green. She left the class, and the other professors opened their doors trying to find out what the commotion was about. Behold, the professor was throwing up all down the hall. One professor even told the other professors to send their students into the hall to see her throwing up. When everyone was in the hall, people started teasing her. The news spread like wildfire. Even though it was 5 weeks ago, no one ever let her live it down, especially since no one knew she was recently pregnant. I bet you never looked at the class the exact same way. At BIOSTUE or DENT, thanks so much for sharing. Once I was at home by myself during my second trimester when hubby was on a business trip, and I ate exactly what my baby was craving: chicken. I threw up and it was creepy. Then I went back and ate it. Ew! P.S. Vomit tastes like chicken when you put salt on it before eating. Oh my gosh, this is disgusting. Caution, the only side effect is later you'll throw it up again. Ew. Do you have a hilarious puke story that you just can't wait to share with me? Send it to me. Pukeology, P-U-K-E-L-L. Let me try that again. Send it to me. Pukeology, Pukeology at NOMONAUSEA.com. Again, Pukeology at nomonausea.com, or tweet me at Pukeology so we can all have a good laugh.
Tips and tricks to stop the up-chuckle that you need.
Don't we wish that there was a Mythbusters that would do an episode on weather and weather related to moms having babies? I used to always say to all the rest of my friends who are also physicians, we would all sit inside of labor and delivery and we would talk about if it was a full moon, right? We knew it was going to be a crazy busy night. We would talk about if there was a thunderstorm, boom, a gajillion pregnant women. It was like herding cattle, literally. Every single bay, every single room. We even had like spaces outside the rooms that were full. It was insane. So again, I always asked, and I wanted to know a little bit more about whether or not like hurricanes, heavy rains, change in moons, like the actual moon, depending upon if it's a waxing or a waning moon, or a snowstorm, can all of these induce labor? As a biomedical physicist, prior to medical school, I will tell you everything that I know. Exactly what induces the start of labor is still a mystery, right? Other than your body saying, hey, there's too much pressure or the contractions. But studies do suggest that a drop in barometric pressure, or the pressure in the atmosphere, again, a drop in barometric pressure, can trigger the amniotic sac to rupture. We lovely ladies know this best as our water breaking. So the amniotic sac is kind of like that balloon that we talked about before, and it's when you lower the pressure on it, there's an increased risk of having it pop. So think of it this way. If you have what's called pressure on the inside and pressure on the outside, when the outside pressure, so the world works in physics as it wants to balance itself out. So if the pressure of the outside drops, the pressure in the inside is higher, right? So what happens when you have too high of pressure? It doesn't explode, guys, but it will pop in order to be able to get it back to a normal level. The sac itself is very well protected, as we know, so a small drop in barometric pressure is highly unlikely to cause or be the reason of the onset of labor as 100% of the contributing factors. I do have to say that during bad storms, like we talked about before, we get a room full of laboring patients. That I always correlated it with my bad luck on the floor until I went back and actually researched and did this one. A study that was done by Yazin and colleagues on deliveries during a Hurricane Andrew, actually in 1992, which was the lowest record drop of barometric pressure. And they found that there was no association between air pressure and labor. So pass on the knowledge, please. But now let's get back into natural ways to break your water, especially if you're delivering at home or having a home birth. The next intervention is for medical professionals only. Do not ask your husband to put his dirty fingers up inside your vajayjay. Okay, now that I'm done with my warning and caution, stripping your membranes. So if you have your membranes stripped by a medical professional, you ask a doctor to strip your membranes. And this is a process that involves a doctor using their fingers to separate the sac of the amniotic fluid from the uterine walls. While it sounds pretty graphic, it's really not that bad. It's not as invasive as you think as having your water broken. So literally, it's just like finger massaging it to separate the two. The uterus becomes irritated and begins contracting a few hours or days after the procedure, often breaking your water once you're at home. Again, in combination with steps 2, 3, and 4, this step becomes even more effective at breaking your water than you would have originally thought. Now walk it out. All right. So I don't just mean walk it out. There's other things you can do. You can obviously do squats and different things like that will help you to potentially start to induce that type. You can sit on a yoga ball, right? Do lunges, walking upstairs, sitting upright in butterfly legs. All of these things start to put pressure to bring the baby down more. But walking and moving is great. So walk, walk, walk. And then when all else fails, walk some more. It's one way in which you can help your water to break in its last days of pregnancy is to walk. Walking is not only a great exercise, but it also helps your little one to drop inside of the birth canal and get everything ready in order for delivery. This in itself can help your water break and bring on the onset of contractions. Remember, don't overdo it. Don't, risk injury to yourself or your child. Just walk about 30 minutes at a time is a good amount of walking. Let's talk about sex, baby. All right, so let's have sex. Just kidding. So have sex, and then more sex. But having sex is sometimes known to help to break your water in the last couple days. And this is especially true if you have had your membrane stripped at your physician's office, then go home and have sex with your husband or your partner. If you're worried that sexual relations might injure the baby, it shouldn't. The only time it's at risk of when having sex or being dangerous is if your water breaks and then you have sex after, because it can obviously induce foreign, bacteria and things like that into the baby. All right, nipple stimulation. So both having sex and nipple stimulation will actually increase that hormone that we talked about before, oxytocin, also known as a man-made Pitocin, right? So this nipple stimulation, honk on those hooters. And nipple stimulation has long been known to sometimes induce labor, and it triggers your water breaking simply by rolling the nipple as though it was like between the areola back and forth using your thumb and finger, like you're tuning a radio. Okay, I know that these days, all these kids these days, they have touch screen on everything, but if you remember turning things, okay, just do that. Do that to your nipples, obviously in a, turning type of manner. Or have your partner do it, and while you relax. It might actually end up stimulating more than what you bargained for. The key to stimulating motion will be the exact same as a suckling type of motion. This is thought to be very powerful in the way that it induces labor, and again, similar to Pitocin. So all of these things. Ultimately, you're going to meet your baby very, very soon if your water starts to break. So it is a beautiful way to kind of speed it up a little bit, because let's be real, ladies, who really wants to be pregnant in the last bit of your pregnancy? I know I was ready. I wanted to give my daughter her eviction notice a little early. But now you guys know the best information that there is to date as to what causes your water to break. What is the science behind amniotic fluid? Whether or not weather can help you, and then the natural ways to speed up labor and safely induce your water breaking. Thank you so much for listening. If you love me and you love Pregnancy Pukeology Podcast, let me know with a 5-star ratings or hearts for likes. And don't forget to download this episode, but more importantly, share it with all your prego friends. Thanks again for listening to Pukeology Podcast and Pregnancy, episode 54, What Causes Your Water to Break When You're Pregnant. See you next time.
Pukeology Podcast, edutainment at its finest.